Hi everybody and welcome to the news from the medical school from today, the 11th of June 2021. Rules around travel, staying at home or being in lockdown change weekly, as you would have seen over the last few weeks in regards to COVID-19. Public health requirements remain in place for Melbourne and Bendigo still has a stay-at-home requirement for the ACT. The good news is that New Zealand has been removed as a geographical area of risk for the ACT, but please, as you would have heard, COVID is back in Queensland. Please watch those events and the messages about travel and restrictions there. To keep up to date, please keep looking at the state and territory COVID sites, but also the ANU COVID-19 website. Now, as you know, we're in the planning phase for the college implementation plan. And this is really just to give you an update of what we're up to. At the moment, there are meetings with psychology staff to clarify roles and responsibilities and see where there are alignments and where we can help each other or where we're actually doubling up and could be a bit more efficient. In terms of the educational support unit, there's also a plan to meet in a bigger group in about 4 to 6 weeks and plan out what this educational support unit could look like in 5 years' time, what we're aiming to be able to do then, and what is required in order to achieve that, and then work our way backwards to where we are at the moment. Just to be very clear, at the moment, all professional staff involved in education are just doing business as usual, so we're not taking on any other responsibilities until probably next year. We're also having discussions about which meetings could be either combined or could be held together every once in a while. Think executive meetings or research meetings. And at the college, a subcommittee will be appointed to supervise the planning period and the implementation plan, and we should all report to that group. In order to understand more where there are similarities between the schools and what they really do, what the Research School of Psychology Director and I have decided to just hold weekly show and tell sessions for staff and with staff and about staff. They will be held every Thursday at 12:30 for about half an hour or so, and that's really an opportunity to learn more about each other. The first two meetings will be held by the school directors and give an overview of the schools, but then we'll have the ADEs and the Deputy Director here of the medical school talk about education, and then we'll move our way into educational supports, but also the research and the HDR arena. If you can't attend, that's okay. We'll record these meetings and put them on the intranet. Feel free to listen in and learn more about. And as I've indicated last time, the academic promotions rounds have opened and will remain open until the end of July. There's a lot of information available on the ANU HR website about those. If you have any inquiries about level B to D promotion, please contact the college HR team. Any inquiries about promotion to level E, please contact the academic promotions team at ANU. These are for full title promotions, not for clinical title. We will also hold practice interviews for those of you who wish to be promoted to a full C or D here at the medical school, and the college will organise practice interviews for those of you who are thinking of being promoted to level E. However, as I need to write a report about all of you and give you a reference, it would be great if you could please discuss your idea or your thoughts about promotion with your academic supervisor first, and if you both think that you're ready for promotion, send me an email with your CV and the statements so I can have a discussion with you. We can see whether the CV is up to the standard that the university expects, and that would help me write a reference for you and give you some guidance. Now, we previously had asked students to please tell us whether they're vaccinated or not against COVID. This would be helpful for their future placements if we have any outbreaks in the ACT. But for workforce planning, we've also sent out a survey and asking staff just to let us know whether they are vaccinated or not. It's a voluntary survey, and as you know, the COVID vaccination is not mandatory either, but it will help us for planning in the future. And congratulations are in order for Professor Kirsty Douglas, our Professor of General Practice. Kirsty was just recently awarded the 2021 President's Award at the annual general meeting of the Australian Medical Association here in the ACT. And the award is a recognition of her contribution to the health services of the ACT. As you know, Kirsty has worn multiple hats during her career, and her roles have really changed from general practice medicine to research, teaching, and on to executive leadership. Her passion and commitment to the practice of medicine, her roles in policy, education, and leadership, combined with her interest in social justice, make her an outstanding contributor to our profession. Congratulations, Kirsty. We're all very proud of you. And congratulations also to Mel Choi and Josh Hickson. They welcomed baby Naomi on the 22nd of April. Naomi is a gorgeous term-born baby. I'm sorry, I do not have any more details about APGAR scores and head circumference, but I'm assuming it's all normal. All are doing well at home. Congratulations to Mel and Josh. And the Australian and New Zealand Pre-Vocational Medical Education Committee meeting will be held virtually on the 18th and 19th of October. It'll be hosted by the Medical Council of New Zealand, and this conference is now open for abstracts. The main themes of this conference will be transitions and innovations, health equity and cultural safety, and professionalism and well-being. Please feel free to put in an abstract. It would be great to contribute to this conference. And those of you who are working in Building 5, you just need to be aware that as of next week, all Building 5 base staff, all the units and all the services will be relocated to Building 8, the newly built Building 8, at the end of next week. So there will be nobody in Building 5, and we also have some offices in Building 8. You should go and check out Building 8 once it's open. It's a wonderful building, and we have heaps of spaces and office spaces there. I had informed you previously that Associate Professor Dipti Talalika has started a peer support program for colleagues, particularly in India, to get advice and support to deal with the COVID-19 crisis. She has now also started an international peer support program webinar series. There's information on the college website for that. The series will kick off on the 16th of June at 7:30 p.m. And Dipti herself will be talking about COVID-19 vaccinations and patients with blood disorders. The series is ongoing, and it would be great to see many of you there and learn about what we know and what we learn to know and the knowledge that we can share about COVID-19. ANZAPE, the Australian New Zealand Association for Health Professional Educators, is also holding their annual conference. This will also be virtual. The topic of this conference is moving forward in ambiguity. The meeting will be held on different dates in July, and registrations for this are now open. And that's all from me for this month. We have a long weekend coming. I hope you will get some time to relax, and if you're working, I hope it'll be okay. I'm sure all the patients will appreciate your support. Please look after yourself and each other. Any questions, please email us, and I'll see you on this channel next month. Bye-bye.